Thank you. All right, so it's time, of course, for our health discussion this morning. Dr. Adedayo Sobamowo is a Nigerian third-generation medical doctor and healthcare management specialist and consultant. Of course, he has with over 17 years of international healthcare business experience. Now he has executed numerous innovative healthcare infrastructure projects and financing solutions. And today, we're talking about emergency medical evacuation. Hello, doctor.
Hello, good morning.
Good
How are you
morning.
today?
How are you doing?
I'm fine. It's a new day.
It is. It
Looking
is.
forward.
Okay, just before
Yeah.
we go straight to our health discussion, yesterday into today, we were woken with some root shock that some doctors might probably be going on strike very, very soon. Why is that?
Well, unfortunately, it's just a historical problem, which is the fact that over the years, the government has signed different agreements, for doctors, mostly bordering on benefits, mostly their salaries and allowances. And each time a new government comes, they sort of renege on old agreements. So it's just this whole back and forth each time. I mean, it's really sad for the sector, especially in a period like this where
Exactly.
frontline workers are very critical. It's really sad, but until those agreements are honored, it will always be like this.
And considering that there is the capacity to do that and it's not being done, I think that's why the doctors you are all going on this. But
Yeah.
then, okay,
Yeah.
wonderful. So today we're talking about medical emergency evacuation, and now let's try to look at it in two ways. In light of the pandemic at this point, because I think that procedures or modus operandi will be different in light of this pandemic and in other normal circumstances of different health emergencies. Am I right to say so?
Yeah, you're absolutely correct.
Okay, good. So let's
Because, I mean,
yeah, go ahead, doctor.
also, what I was going to say was, so prior to the pandemic, if you wanted to sort of be evacuated in an emergency, I mean, all you needed to do was basically just have a service provider who would bring an air ambulance, a helicopter, and basically evacuate you to wherever you chose to go. But with the pandemic now, there are two issues. So there's the issue of getting a clearance to either go within Nigeria or even to leave the airspace. And then for your destination, you also need clearance to fly into that country. So it's more difficult now.
All right. As health, the health sector in Nigeria is one that has really been ignored for a very long time, should I say, or not given as much attention as should be given. How would you rate our emergency evacuation services as a country, looking at our health sector? How far down the road are we? How much further do we need to go? Where exactly do you think we are?
To be honest, in terms of emergency response, we're still at a very, I'll say, basic and rudimentary stage. I mean, over the years, especially the past, I'll say 5 years, we've seen more effort, especially from the government. So that's the federal and state governments. So you have the different emergency sort of response organizations. But in terms of looking at the scale of Nigeria, both in terms of size and population, what we have is still gross inadequate. And most of the sort of interventions we've seen have been led by the private sector. And I think that's just not peculiar to health. If you look at most industries in Nigeria, the private sector just tends to lead, and then sometimes government is forced to wake up and catch up, or sometimes it's just the private sector. So right now, there's still a lot of work to do, still much to do.
Okay, so what can be done? Let's look at a panacea for this problem. What can be done? Because as much as the health is about the most important thing, one of the most important things in the nation, healthcare is really a problem. What can be done?
So it's a good question. So I try to look at things holistically and not just looking at them in silos. So the first thing is, on the policy level, there has to be a clear policy sort of direction from the government saying that, you know what, healthcare emergency is a priority, and then two, there has to be funding allocated for this sector. So right now, we don't even have enough sort of expenditure or budget for healthcare services as a whole, not to talk of emergency services. So just to sort of break it down, 3 areas need strengthening. One is the policy and strategic direction. Then you have, of course, your financial commitment to such an initiative. And 3 is the human resource needed. So we need highly skilled personnel, doctors, nurses, paramedics, and the other members of an emergency team. So it's a lot of work.
Okay, so Doctor, now something I wanted to mention is this. Do we in any way have some sort of data when it comes to emergency situations that went south, like per se situations of maybe patients that died that could have been saved, or issues that degenerated into worse conditions when it comes to emergency medical evacuation? Do we have some sort of data to kind of stir us up? Is there any data as such available to us in the country?
So the problem with data in Nigeria is 2 things. So one is generally not enough data is collected, and even when it's collected, most times it's not aggregated. So you just have different pockets of data spread around different parts of Nigeria. But in terms of aggregation, it's really hard. I mean, I know the Nigerian Bureau of Statistics, NBS, has over the years done a lot of brilliant work. But in terms of what you're asking for, we don't have any central repository to show that, you know what, this was happening in terms of evacuation. But I mean, with different incidents, we've seen over the years that it's a big problem. And what comes to mind for me are the different air crashes we've had over the years. I mean, the issue with the Dana airline that crashed a few years ago, I mean, that was really sad because according to people who are on ground, I mean, the passengers were there and basically just screaming and crying for hours before they could be evacuated, which is just really sad, very, very sad.
Doctor, thank you very much for spending this time with us. But let's hopefully something can be done. We are in a medical emergency pandemic. Let's hope that something can be done, and your pleas, the pleas of the enemy, are listened to, so that we don't have your members and you going on strike. Thank you very much for this time, Doctor, and wishing you all the best.
All right then. Have a nice day.
Thank you, and you too. All right. That's it. Healthcare, they are about the real heroes that we know now. I mean, a number of us know the Avengers and all of that. Where are they? The ones we can see now are medical healthcare workers. Thank you for doing the job you're doing. Let's hope that the government can sort this out and that imminent strike is averted. We'll take this short break. Don't go nowhere. We will be right back with much more.